Would have to break it here and cross over to a news conference that has been put together by the Coalition for Public Health and Justice on Illegal COVID-19 Vaccine Rollout in Ghana. You're still live here on JoyNews.
And therefore, that kind of situation is even stronger than a double dose of some of the vaccines. Indeed, the data shows that you have a 71% effective coverage in comparison with the 67% when you've had 2 doses of vaccines. At this current point, many of the key countries are reviewing strategy. And one wonders why in Ghana, along with these countries who have suddenly done a U-turn. If you take the UK, they were expecting that in April 2022, they would go full stream ensuring that everybody gets vaccination. But here we are in February, there's a U-turn. Vaccine mandates have been dropped. The issue of making sure that testing is done all the time has been dropped. And now there is a recognition that natural immunity gained from previous encounters with the COVID virus should now be considered in terms of your immunity to the disease. And therefore, that should allow you to go around the country doing legitimate business without being infringed upon, being obstructed, or being compelled to take a vaccination. Question is, what is Ghana doing? Why are we still in February 2022 insisting, forcing, and compelling citizens of our nation to have to take vaccinations, where the risks involved in these medical things have not been clearly established, and when Ghanaians are very concerned about that? So I'd like to start with that and say that there is a global context that ought to reflect in the strategy that Ghana has chosen. Now, let me talk a little bit about what WHO has said so far and use that as a bit of grounding why this discussion is so important. Now, the WHO has said that efforts should be made to demonstrate that the benefit and the safety of the vaccines are clear so that there's a greater acceptability amongst the citizenry. Now, although in Ghana, the GHS, Ministry of Health, have talked about some of the benefits, there's been almost no discussion about the risks, the safety issues. If you go to the website at the moment, the GHS, MOH website, there is no reporting on the risk, on the adverse reactions that Ghanaians have experienced. And for transparency and accountability to build confidence in citizens, that ought to have been the case, as is being done in the US or being done in the UK. What examples of people's bad experiences have we captured? And are we conveying to the citizens so that they know that, okay, these are the risks, but these are the benefits. You make your personal choice. And that is an ethical issue, which we are very concerned about. That ought to have been highlighted up to now. And the government of Ghana is not doing that. Again, they say that decisions about mandatory vaccination should be supported by the best available evidence. It should be supported by the best available evidence. How are we gathering the best available evidence globally to draw the conclusions that we have on this subject matter? So, if you consider that some of the health facilities have become very ruthless in insisting that public health doctors and practitioners must get vaccinated, otherwise you lose your job, and the other public sector and private sector institutions doing that, livelihoods are being affected when best practices are not being followed as far as the WHO has made us understand on this issue. And that is a major concern. Let me also state that in general, the WHO did not support mandated vaccination. What they said was that it was important that through education, citizens should be led to have an understanding of the issues and then voluntarily accept to be vaccinated. In other words, let them make the best choice based on the information available, because that is what the ethical considerations highlight. Unfortunately, that has not been the situation here. Whether at the airport, whether in the health sector, whether in schools, all of a sudden, without the consent of parents, children are being vaccinated. It raises serious concerns. Let me just pause and add the fact that in Ghana, for a mandate to be acceptable, for it to be legal, there ought to be an executive instrument. As of today, there is no executive instrument that has been executed by the Minister of Health, therefore making legal the mandatory insistence on vaccines. And that's a challenge. That's an absolute challenge. It means that our statement that these are illegal vaccinations is underscored by the current legal regime. I don't know whether our public sector officers understand what they are doing. And it's the reason why, as a coalition, we have proceeded to court. And I'm sure the lawyers will be speaking to where we are in that court process. Now, again, the WHO stated that vaccine mandates should be exercised with very due caution, except for a situation where all other feasible options have been considered and there is no other option. When there is no other option, the question is, is there a situation that we have no other option currently? Is there a situation that we have no other option currently? That's not the case. That's not the case. So, where lies the basis and justification for an insistence on compulsory vaccination or mandated vaccinations? There's no clarity on that, and we are quite surprised. The toolkit for tackling COVID-19 is constantly growing. And there are several antibody treatments. I mean, Dr. Timothy Ama has mentioned some. I want to add a few more, just to show that the options are so many that for anyone who's a scientist or a doctor, it doesn't make sense. Honestly, I'm wondering why I went to school. Because I can't get it. So let me just mention some more of the other treatments. Why it doesn't make sense we are insisting on vaccines. So we have Zevudi from GSK, recently approved by the UK. It has been found to reduce hospital admission and deaths by nearly 80% in high-risk adults. This easily, and they will also have the easily consumed molnupiravir and Pfizer's Paxlovid. These are oral antivirals, so you just swallow it. That's it. It's not a jab. Okay? And they have all been found and proven to have high safety and efficacy. The other drugs that have been approved by the WHO, including baricitinib, a drug used in the treatment of rheumatoid arthritis, and sotrovimab, a monoclonal antibody. The availability of all these drugs make the decision of our government to make a vaccine situation mandatory makes it questionable. Especially when you are asking yourself, are these vaccines the only solution or the last resort? They are not. So I've just added about 5 more drugs that are available. So why do we have compulsory vaccines? Your guess is as good as mine. I think Tim has already alluded to Big Pharma and what's going on. Furthermore, recent evidence from the UK suggests that prior infection reduces the chance of infection and transmission to a degree similar to immunization, with benefits as much as 13 months. And this is according to the Office of National Statistics in the UK, compared with 2 vaccine doses that reduce the risk of testing positive by 67%. So you are comparing natural immunity that gives you 71% to 2 doses of vaccines that give you 67%. Which one is more effective? Natural immunity. Persons in favor of vaccine requirements have argued that it is necessary and proportionate to protect the vulnerable patients, and that is why they are doing it. However, the ability of the recent Omicron variant that evaded all the initial vaccines. So all the vaccines that we're using did not deal with it. And many of the drug companies had to go back to do work to find out. To the extent that asymptomatic health practitioners were also transferring and transmitting it. Tells you that vaccines by themselves cannot solve this problem. If you want to use vaccines in a situation where people are asymptomatic and where they are not stopping the transmission, it means that vaccines alone cannot solve this. At this point in the pandemic, given the fact that many countries are reconsidering their approach, given the fact that the target of 80% herd coverage across the globe, there is no single country, even those who have exceeded the 80%, have not yet achieved the so-called herd immunity. It means that the theory has not been supported by the evidence on the ground. I hope that makes sense. The arguments we have been told in the past that, oh, keep vaccinating. Once you exceed 80% of the population, you will suddenly find that the numbers start coming down because you have achieved herd immunity, and therefore there will be a reducing number of people who are getting infected, and the whole situation will change. It's not happened. In Israel, in Ireland, in all the countries that have gone far ahead of us in doing vaccination. Rather, the countries, as Tim said, 4 of the top 5 countries where they have done more vaccination, where some of them have exceeded the 80%, they have seen spikes, surges, and more peaks. In other words, more people seem to be getting it in those countries. It means that the theory we've been talking about has not worked. It is time to reconsider the approach. According to the Ghana guidelines for emergency use of medical products, one of the reasons why emergency use approvals or authorization is given is in a situation where there is no adequate, approved, and available alternative to the products for diagnosing, preventing, or treating such serious life-threatening disease or conditions. Can I say that again? You are given emergency use approval for a vaccine. It is only done when there are no other options. Hello? So I'm even wondering why this approval was given when there are options. The condition for giving emergency use approval, and emergency use means that it should not become the default. It should be the exception to the rule. Let's get that right. What emergency use approval by our FDA means is that the use of the vaccines in Ghana should be the exception and not the rule. That's emergency use approval. And it also means that the approval itself ought to have been given only in a context where you do not have effective alternatives that can deal with the situation. After 2 years of scientists working hard to get on top of this issue, and where scientists across the globe have provided alternatives, one cannot understand why our experts and the so-called technical group meeting every 2 weeks advising government. Fortunately, our president seems to align with the citizens on this matter and say there's nothing mandatory. I mean, that tells us that at least there's hope for us. Why are other ministers and directors taking a position contrary to what the overwhelming scientific evidence shows, and contrary to what the laid down legal framework allows them to do? It doesn't make sense. Why are they holding on to old knowledge and not making any effort to stay abreast with current options? For example, I mentioned 5 already. Let me mention some more. Locally, we have dexamethasone and remdesivir, which are being used effectively to treat people with COVID-19. I've refused to mention the ivermectin, hydrochloroquine, erythromycin, because people want to argue against them. So let me mention 2 more. I've just said there are others. And this information, you know, by the way, some of these are even on the applicable use at Kolebu. They are being used for human beings. Now, why isn't that education at the forefront of what our public health officers are saying? Why are we only going vaccine? Why are they not telling you, oh, there are drugs you can take? It is for this reason that the WHO makes it very clear in its policy brief that individual liberties should not be challenged for longer than necessary, which is what they are doing to us. Our liberties and rights are being challenged. Policymakers are required by WHO standards to re-evaluate the situation of any form of mandate regularly, so that as soon as necessary, if a mandate becomes unnecessary, you remove it. What review is being done within the global context? Especially when we know that vaccines by themselves are not the panacea for the situation we find ourselves in. Let me move on to add the fact that people have genuine concerns, and you'll be hearing from some of the people who've been impacted negatively in a few minutes. Spoken to this already, so I'll move on to the next slide. People have genuine concerns about what happens to them when you inject them with these things. Is it right that if I have a concern, you should listen to my concern? Isn't it right? Is it right that if I feel like I don't want to take this for my own good, it should be taken on board? Is it right, especially when our national laws tell you that if I say I want you to test my natural immunization, my natural immunity, you should provide the facilities for me to be able to show that I'm naturally immunized? And when the state has not done that, why should I be compelled to take your option when I have an option? So, if vaccines who have been have been labeled as experimental, which have been labeled as emergency use, have suddenly become the norm around the globe, should all of us just follow them? It is a fact, and anyone can check, that at the moment there are over 1,000 scientific studies reporting on the adverse effects. And I've listed some of them there. Many of them, Tim mentioned some. Let me mention some more, just so that you know the risk you expose yourself to and the reason why Ghanaians and many citizens across the globe are concerned. Paralysis, menstrual abnormalities, blood clots, myocarditis, pericarditis. This one are heart things. Heart inflammation. We should have shown some of the video clips with the sports people who are collapsing on football parks, basketball fields, etc. Cardiomyopathy, vaccine-induced thrombotic cytopenia, autoimmunity resulting in death, cerebral hemorrhage, thromboembolism, and several unexplained deaths following vaccination. Isn't it interesting that Ghanaians are not being told anything about these unfortunate side effects? Is it also not curious that anybody who raises issues is immediately being told, keep quiet? Oh, what have I done? To come back. Oh, why does it keep doing that to me? It is in this context that we believe strongly that not only are the vaccine mandates illegal, and we are asking the president and his ministers to stop the promotion of these illegal vaccine mandates. We also believe that it is time that the technical team and all the advisors reevaluate the data. I side with Tim. The initial, and it's interesting. The coalition is from different splinter groups that had raised concerns from last year. And it's only in the last week or so that we got together. So I didn't know what he would talk about today. And he's taking some of the issues that I would have raised. But truly, and I want to highlight this, that as I listened to the doctors talking about the vaccines prevent more serious impact or adverse impact, the data they provided, straight in my mind, I was like, where was the big end? The population size. You know, in statistics, you need to be cautious how you do your percentages. And they kept talking about their facilities without realizing that the total population of Ghana ought to have been the base for the calculations. And there was no way the percentages were calling would be possible if they were considering the fact that 80 to 90% of Ghanaians had not been vaccinated at the time they were doing their calculations. So the data being provided at the moment by our health leaders, the way they have calculated the percentage is skewed. Ask them to go back and look at the statistics well, perhaps get some professors to help them. It is in this context, therefore, we appeal to our president, His Excellency Nana-Addo Dankwa Akufo-Addo, to call his ministers and appointees to order, to do what is in the best interest of all citizens, not some citizens, not a majority of citizens, in the best interest of every single citizen of Ghana. That is the mandate we have given him and this government, because every life counts. Vaccinations may continue to the extent that citizens understand the risks they are exposed to. However, compulsory vaccinations should stop, and they should stop now. We call on the Minister of Health and the Director General of the Ghana Health Service, together with the Minister of Education and Director General of the Ghana Education Service, and all the other public institutions, parliaments, and what have you, I think there are about 13 of them, to withdraw the various directives mandating vaccination. We urge the government of Ghana and its technical team to consider and promote all the safer alternative options that are available. And not just that, they should regularly highlight these safer options, as well as provide information on all the adverse reactions that citizens have experienced in Ghana as a result of vaccinations. We, as a country, should not force. We should not compel. We should not insist. We should not, for whatever reason, drag citizens in public institutions and say, you will lose your job if you do not get vaccinated. This infringes on citizens' rights, our rights, to make personal informed medical choices as we deem fit. It will affect Ghanaians in the long run, and we believe that this does not promote the democracy and the democratic credentials of this nation. We thank you for your attention. God bless you, and God bless our homeland, Ghana.
Thank you very much. Thank you very much. Now we've listened to the first and second speakers. We are now going to listen to the third speaker, who is a lawyer in the person of Richard Nunek Beku. Sorry if I pronounced the name wrong.
Good afternoon to everyone. I have been very concerned listening to the doctor and the scientists giving us the science and data about COVID-19 and the vaccine rollout in Ghana. But if you are here or listening to me and you are not concerned about the science and the data, there is one thing I want you to be concerned about, which is the illegality of the mandate that have been rolled out. We live in a country guided by the Constitution, which is the supreme law of this state. And that Constitution mandates certain performances by public officers particularly. So the president is not above the law. The minister is not above the law. No state institution, likewise, is above the law. So we will expect that whatever they do, be it a directive, be it a mandate, must be in compliance with the laws and regulation of this country. Because that is the only reason for which we exist as a country. And for us, as a Coalition for Public Health and Justice, our concerns are not only medical. Our concerns are also legal. And those are some of the issues I'll be speaking to this afternoon. Now, first and foremost, we will appreciate that we live in a country governed by the 1992 Constitution. And we always say that as a country, we believe in the rule of law. And the basic meaning of rule of law is that you act in accordance with a certain law. So everything you do, you must point out to which law gives you the power to do so. And our concern basically is that the 1992 Constitution has guaranteed for all of us here and those listening to us from their various locations certain rights and freedoms. one of the basic rights and freedom guaranteed by the Constitution is found in Article 21, 1G, which is a freedom to the right to the freedom of movement. And if you look at the Constitution clearly, that right includes the right to move around freely within Ghana. So it implies that no one can restrict that right except within the context provided for by the Constitution. So therefore, where we have mandates that are requiring citizens and persons, be it employees or other stakeholders, engaging public or procuring the services of public institution to show proof of COVID-19 vaccine, otherwise they will not access the facilities, we think that such mandates are restrictive in their strict sense. You cannot run away from the fact. So if you tell me that if I do not show a COVID-19 vaccine card, I cannot come to school, what are you trying to tell me? You are telling me that I do not have a right to education, indirectly. If you are telling me that without a vaccine card, I cannot access parliament to meet my members of parliament that I have queued and voted for to represent me in parliament, you are telling me that I do not have a right to move freely. So for us, we are concerned about that. And we also recognize the fact that beyond these rights being provided for in the Constitution also enjoins persons in authority, including the legislature, the executive, and the judiciary, to at all times uphold the respect for these rights. So no one have an excuse not to respect the rights that have been guaranteed by the Constitution. However, these rights we know are not absolute. Why do we say these rights are not absolute? Because within the constitutional framework, you have provisions that provides for circumstances under which certain restrictions or limitations can be placed on the enjoyment of this right. So for instance, if you go to that Article 21.4, a list of circumstances have been provided. And we all know that when COVID-19 broke out, Parliament of Ghana passed the Imposition of Restrictions Act, which the President has religiously in the past used to impose certain restrictions on our movement. So the lockdowns that were imposed in the past were on the basis of the exercise of President's power under the Impositions of Restrictions Act. However, there is a basic provision under that law, which mandates the President only that if the President so wishes to restrict the freedom enjoined by the Constitution, the President is supposed to issue an executive instrument in that respect. And as we stand here today, no executive instrument have been issued by the President in that respect. And the President, in his response to the concerned doctors, have also indicated clearly that he has not mandated any COVID-19 vaccine in Ghana. So the question we ask is, where do the persons and institutions that are mandating compulsory COVID-19 evidence getting their power from? Where are they getting it from? That is what should be of concern to all of us as citizens. Whether you believe in the science or you believe in the data, the lawlessness that is being paraded around today should be of concern to you. And that is why, as members of the Coalition for Public Health and Justice, we think that there is an opportunity for us to go to court for these institutions and persons to come and show us where they are getting their powers from. Because we do not live in a country without laws. We live in a country with rules and regulations, and we expect anyone who acts to act in accordance with those rules. Now, you remember the speakers before me were of the view that the minister can mandate compulsory vaccination. That is true. The Public Health Act gives the minister the power to mandate compulsory vaccination. But the minister can only do so when the minister passes or issues what we call the executive instrument. Now, there is something curious under that power. If you read the provisions of Section 22 of the Public Health Act at 851, you will come to the realization that certain persons have been exempted, even if the minister issues an executive instrument mandating COVID-19 or any vaccination which should be compulsory. Persons who have natural immunity. And the speakers who spoke on science and the data have also shown you that the effectiveness of natural immunity is even higher than the COVID-19 vaccines that we've seen today. Persons who, for health reasons, cannot take the that is even worse, because the speaker has no such powers to mandate such vaccination. And if you look carefully at the regulatory regime for medicinal products in Ghana, we all know that the Food and Drugs Authority is the body mandated to regulate the licensing and approval of medicines in this country. And if you look at the guidelines that was issued by the Food and Drugs Authority, under which these COVID vaccines are being rolled out in Ghana, which is the Emergency Use Authorization Guideline, you'll be shocked to note that that guideline clearly provides that where a medicine has been given an emergency use authorization, it implies two things, critical two things. One is that the consequences or the health risk associated with that medicine is unknown. So what we are taking today in Ghana as COVID vaccines have unknown health risk. Two, when such authorization is given, persons who are supposed to take those vaccines are supposed to be given enough information to be able to make personal decisions. Very important. Personal decisions, whether or not on the basis of the information they have to take the vaccines or not. So by the FDA guideline, you cannot compel anybody to take the current vaccines we have in Ghana. By the mandates that have been issued, you are compulsorily forced to go and take the vaccine. So are we respecting our own guidelines? We are not. The guidelines that we have in place for the interest of all of us, for public health and safety, to ensure that medicine and medical products that are administered in this country follow a certain protocol to ensure that we don't put the population at risk, is being abused. Persons are now being forced to take the vaccine without the options they have under the FDA guidelines. And we think that that must stop. That is without legal basis. That disregard for public policy and laws is becoming too much. And we will ensure by our court processes that all these institutions are ordered by the court to stop this mandate. Now, interestingly, the doctors and the doctor and the scientists have spoken extensively about the safety and the efficacy of the vaccine. There is something I want to add further. If you look at the contraindication report that is issued by the CDC of the US, you realize that these vaccines have serious health implications for those who have taken it or those who are being forced to take it. It is not one that we should encourage our citizens to take without the opportunity given them to exercise their personal decisions. Our policy or our agenda is not to discourage the taking of the vaccines. Our agenda and our goal is simple. We have individual rights. Those rights are guaranteed. Let us exercise those rights within the framework of law as provided for in Ghana. No one should be compelled, either by a directive or by a policy mandate, to take the vaccine, given the generality of the laws that exist, that we have said that the institutions and persons that are mandating these compulsory vaccinations do not have any power. Do not have any power. It's only the president and the minister. And even that, there are contexts within which they can exercise those powers. So you ask yourself, where is the vice chancellor, for instance, or the registrar of UCC getting that power from? Where is the director general of the Ghana Broadcasting Corporation that have said that if employees do not show cards of COVID-19, they can't come to work? Where does he get that power from? What are we creating? Are we creating institutions governed by rules of men, or we are going to create institutions governed by the rules that we've all agreed to govern us? So those are the legal concerns that we have. And we think that it is incumbent on all of us as media men and citizens to join this campaign. Because if, like I said, the science doesn't matter to you, the freedoms we have should matter to you. This is a country that is governed by laws. The 1992 Constitution remains supreme. And then we expect that everyone who acts must act in strict accordance with those provisions. Thank you very much.
Thank you very much, Council. So we go straight to our Q&A session. But before that, just want to do this quick exercise here. So those of us who over the month, let me say, start questioning about our existence, the coalition existence, we have a certificate here which shows that we are a registered entity. Thank you very much. So those who, for the camera's sake, let me. So we now go to our Q&A session. Please, if you have any question to ask any of our presenters, please raise up your hand. We have extra microphone here. I can get it to you. We need 4 sets of questions, or 3 at least. If any. If we don't have any, we proceed. Okay, TV3.
Thank you very much.
Please, you mention your name and where you represent.
My name is Samani, Emmanuel Samani. I work with TV3. So my question goes to the scientists. You made mention of some alternatives to the vaccine. You made mention of dexamethasone as well as some other medications in the treatment of COVID-19. I just want to point out that from what you said, I also looked up the WHO website, and the WHO website did indicate that these medications are not to be used for COVID-19. But you stated in your presentation that the WHO has actually licensed these medications for the treatment of COVID-19. Secondly, with regards to the efficacy levels, for my research, Pfizer has 95% efficacy, which runs to at least 6 months. And I also want to be clear, if you are against the vaccine mandate or the vaccine itself. And from Dr. Timothy, his presentation, he also made some remarks. I just wanted to find out from him if these remarks are from peer-reviewed scientific journals, so we can actually also do our own research and draw our own conclusions, because some of the statements made, I tend to disagree. And finally, I'm glad that he did mention VIAS in his presentation. I'd like to ask him if he knows that VIAS is an open site, if you will, that anyone can go and post on there, like Facebook, like a wall on Facebook. So how are you confirming these reports of vaccine as serious side effects? Thank you.
Thank you. Before you want to respond to? Okay.
All right. So I think you prompt me if I don't remember some of them. So
sure.
The first one you had was about the dexamethasone and remdesivir, and the point. Oh no, I heard you. Let me speak to it. Yeah. Now the point I made. Please pick a copy of the full text from Tim. Please give me a copy of the full text. Now the point I made there was that locally, dexamethasone and remdesivir are being used for the treatment. It is the same as the fact that ivermectin, hydrochloroquine, erythromycin are being used. And yet, in other jurisdictions, people are insisting that these are not efficacious. Hi, are you with me?
I'm listening.
So, if you pick a copy, you'll find it that I've said locally, dexamethasone.
So what you're saying is that this is a local treatment plan, not based off an international standard. This is a treatment plan that you or your group are actually using.
No. It's not a.
I just want to get the clarification.
No, yeah, and I've stated it. And the clarification is that locally these drugs are being used.
Yeah, but it says
Sorry.
It says here for a fact that I think we can all check. It says hydrochloroquine or Dexy, was
let me make my point.
Okay.
Part of what we've been saying is that the position taken by external people should not always be what we should be looking at. What local investigation and research are we doing into what has worked here? Are you getting the point?
Yeah,
because our doctors and practitioners, especially in a context where we have done very well, Ghana has done very well, go and engage the medical and health practitioners. And the drugs that in the US and elsewhere they say don't use are the same drugs that have been used here. Tim said the same thing, I'm saying the same thing. And they found them to be very effective. It doesn't make sense. So we are saying, let's do some more research. Let's establish what has worked locally. Let's not just pick up what others have said and say, don't do this, don't do that. Especially where their situations have proven worse off than ours. So what are we doing right? I hope I'm making my point. Okay. I've always wondered, across Africa, we've done much better. What is it that we have done differently? When they wouldn't give us the vaccines, when they could not arrange for us to receive them, our local doctors came up with solutions, and here we are. And those who have pursued, have championed, and run after more and more vaccinations, those countries especially seem to have more surges and more spikes. Something doesn't fit together. Something is not connecting. And that's the point.
Okay.
Now, what's the next point? What was the next question?
So I don't want it to be like a debate. I just want to,
I've answered that. So I'm saying more local research.
Yeah.
Next.
So more local research. So is it a controlled study? So that when you're done treating, say, 60 number of persons with a particular drug, then we know for a fact that whoever is having COVID-19 symptoms, if you treat them with so and so, we know for sure.
Absolutely. Okay. We need something with controls, an experimental design that takes all these drugs. And we are worried that we may have a situation where Big Pharma is taking advantage and exploiting citizens across the globe. That we are really concerned about that. I'll just be blunt about it. That we are taking advantage of citizens across the globe and pushing an agenda when the doctors who are treating us, I was treated with some of these drugs. I was treated. My family has been. I'm sure if you could do that research right now, talking about erythromycin, ivermectin, hydrochloric, right in this room. If you like, try that question and you will see the result. Next question.
So, from the medical point of view, I know those drugs, as you listed, WHO has commented on it. Yeah. But what is really happening on the grounds is that when we have COVID pneumonia cases, in fact, to reduce the level of inflammation and all that, across board, all doctors use dexamethasone. You may challenge it, but that is what is happening on the grounds. Anybody who is experiencing COVID will tell you one way or the other, hydroxychloroquine has been thrown in, or azithromycin, and they have recovered fully. So just to add to what he's saying, now your question on whether we are fighting the vaccine or the vaccine mandate, we need to make it clear. When you are mandating something which is good, you just get a small fraction talking about it or raising questions. You can mandate something which you think, or per the data showing, 1, it is necessary, 2, it is effective, and 3, it is safety. But if you cannot prove to your citizens that 1, your vaccine is not necessary, 2, you cannot prove to us, because when we wrote back to him, we were expecting quite a long list of research, which they called our research that we proved, whether it's been peer reviewed, we quoted from sites like the way you two. Okay, I have quoted mine, but what about that? What about theirs? Where are their research findings? The only thing they could prove to us was the data they collected overnight from GIDC. And these are things they know it's true. I don't think as citizens we should go into the muddy waters. If a vaccine is good, even let's consider the polio vaccine. It is a good vaccine, but why are we not mandating it? There are several children who have not received polio immunization, but do we mandate it in schools? Do we mandate it? No, these are things we don't. There are several people who are traveling and they've not even received their yellow fever vaccine and they are able to go to other countries. So this is what we are saying. Is this necessary for us as a country? Is it even effective and is it even safe? You may talk about VAS just being like Facebook, but I tell you, With VAS, at least they are reporting just 1% of all that is happening. And these are people who are freely talking their mind and their personal experiences from their consultation with their doctors in their consulting room. I have several of such clients I deal with like that, where they come, you do cardiac enzymes, and the enzymes have shot up. You do ECG, and you are seeing your ECG changes. You do D-dimers, and there are blood clots all over. And some even reporting with DVT. We call the centers, nobody minds them. But we... So, please.
Go on. I mean, this is why we are here. So,
yes.
To get
So
the clarity
I think you should understand why we are fighting the mandate. There's something fundamental which is wrong. You have not been able to prove to your nation whether this is necessary. And you can only prove it is necessary when you look at the data which is staring right at your face. And Ghana has been doing well, proud to the vaccines coming in. Then we look at the efficacy of the vaccine. You've not been able to prove to us. Where are the research findings? They should bring it. Just like the way we have brought ours and we are talking about it. So they should also bring it out. They should come and tell us, these are our research findings. That shows that this vaccine is efficacious. And not something which has been cooked over the night. No. We are scientists and we are doctors. We need to stand for what we have been called to do, to serve the people of Ghana, and that is exactly what we have to do. Thank you very much.
Okay. Thank you very much, Doc.
Yeah. Such a number of them.
Oh, it's a mandate. Okay, yes. The second question was whether it's against the vaccination mandate. It's against the mandate.
Against the mandate. So that's the...
Vaccinations can continue. Okay. And vaccinations have proven to be very good for all of us in the past. We grew up being vaccinated. But this mandate, because of the peculiarity of the vaccines being... There's a problem because the risk suggests that I should be given the opportunity to decide, will I take it or not? So that's why we're saying, continue the vaccinations. We don't have a problem. But allow citizens to have the choice.
Okay.
And don't allow... Let me tell you. Look, our first press conference was on the 14th of December. What happened? Medical doctors and directors who are members of our group and those even outside were like, isn't anyone going to talk for us? We were given a deadline of 15th December. You know, so at that time last year, 15th December 2021, some medical facilities had given their doctors and whatnot a deadline that if you've not done it, you can't come to work or something like that. So it was the doctors at the front line, public health officers who were concerned. And so we called it on the 14th to try and raise our letter. Please, government, people are not happy. Some of us were not being, I could still have gone to work. But for the sake of especially medical health practitioners who are like, we've been given 15, what are you people saying? How are you helping us? So please, it's a choice. Allow our citizens not to feel like it's a crime to have offered myself to serve the public. That's not right.
Thank you for the clarification. And finally, I also wanted to point out that no, it's not a question. It's
before that, I beg you. There's one of our doctors who want to respond to your question.
On so which one?
On the vaccines.
The VAS. Okay.
Hold on. Hello, Doc.
Yeah. Hello.
Yeah. Please continue.
Oh, okay. Yes. Good afternoon. I wanted to address the concern with an adverse effect after taking a vaccine. Doesn't mean the vaccine causes. That's fair enough. But in everything, you need to compare like variables with like variables. Using the same bias, you can compare the adverse effects to these vaccines with other vaccines and with other drugs. And you realize that with the COVID-19 vaccine, the numbers are through the roof. That's number one. Number two, most of these people, they report these adverse effects within less than 2 weeks of going for the shot. Number three, entering data into VAS is not as simple as Facebook. If I take my Facebook and I just type thinking about ABC and I just press post, it comes. VAS is not like that. VAS is a complicated system where even doctors get frustrated. And that is one reason why a number of doctors in the US don't even report to VAS, because the system is frustrated. It doesn't make sense for somebody to frustrate himself just to fake an adverse events report on VAS, which will take at least 30 minutes or more to do. The stress is not worth it. Even if there are people doing this, how many people are doing this? Out of the over 20,000 reported deaths, how many people are sitting down and saying, let me just go and fake a report on VAS? It is not practical. Not to say that every single report on VAS is credible, but you have to consider the context. It is not the best system, but it is the best we have so far. And even research from Harvard will show you that virus only accounts for up to about 1% of the adverse events. You understand? So yes, even though virus is an open system, it is not like Facebook per se, or Twitter or Instagram, where I just put something there and press push. There are certain things you have to go through. And for the last point, a number of the various reports are actually vetted by the appropriate authority. Usually they don't get through all the time, but most of them are vetted. Those that are proved not to be, what's the word? Not to be relevant tend to be taken down. There are some duplicate reports and all that. All those things are taken. So yes, virus may not be the best, number one. It may not prove causation, but it is not something we should dismiss. In fact, most experts with adverse events as relating to immunization say that this is one of the best systems worldwide we have.
Okay, thank you very much, Doc. Okay, so that's it, TV3.
Yeah.
Please, let's pass the...
And I just wanted to also add on that after the rollout of the National Vaccination COVID campaign, it is said that should anyone have any side effect, they can report to their nearest district for free treatment of any side effects that comes out as a result of that. Yeah.
Thank you. I think that's a good point. I think Tim pointed out that people have been calling. Sometimes there's an emergency. The doctors themselves are calling the technical team to try and get feedback, and they're not getting the support. So it's on paper, but the system to make sure it works for the citizens does not appear to be in place. So let me highlight that. It's on paper, and it's good they are saying it. But the system, those who have tested the system to try and get support, they are not getting the help they need. So if we really want it to work, let's do much more to make sure that that system is reporting the adverse effects and is providing support to individuals. By the way, I don't think we've mentioned the fact that we hear there's some money for people who get affected and we don't know what's happening to the money. Is it true? It's not true. Okay. All right. Please, who's next?
Okay.
Metro TV.
Hello. Okay, so my name is Elvis Ando, Metro TV. My question is, you've tried all attempts. You've organized press conference. You've petitioned the president and also filed a suit against this whole thing. What is the next line of action for you?
We just mentioned that in our, I think Doc mentioned that we, and then the lawyer also said that we go to court.
I think I missed that part.
Okay,
so
sorry
if it can be recorded.
Okay, so I think this time, if no question, we call on the national
sorry, my question hasn't been answered. So I want...
Come again.
Yes, you've sued, right? You filed a suit against the government for the process. And you also organize press conferences, and also you have petitioned government. What is your next line of action? So you say you are now going to court. That is it, right? Okay, thank you.
And the answer to that question is that we are filing a suit in court. We believe in justice as well, and we are law-abiding citizens. We strongly believe that the court system is an avenue for us to get this stopped.
Yeah. Yes.
So we'll pursue that avenue, believing that our arguments are sound and they are what the law prescribes. So the judges will agree with us and get this illegal mandate stopped.
Okay, I'm Calvin from GH1 TV. Yeah. I just want to know if the coalition has the intent of researching into local medicines that could be given to the government or suggested to be used aside the vaccine that we are taking now.
It's a nice idea. Please, so we'll use this platform to ask well-abled Ghanaians, individuals and corporate entities. A few months ago, I went to Noguchi asking why we're not doing our local research. And they said, look, we are more than eager. At the time, they already had about 30 Ghanaians with options, remedies that have been submitted. They needed funding. And I asked how much. I think at the time they were talking about if they had about 200 million Ghana cedis, they'll be able to do the research. And you know, when you find even one, the money that it will make for this country will be so much more. So let me use this platform as it were to make a campaign for our local indigenous herbalists and whatnot. And not just them, but also Noguchi. Noguchi has one of the only, I think, P4, there are 2 P4 labs in the whole of Africa. They have the capacity to do this research and to get out results that will make this country earn resources. And so let's raise funding for our own people. What is from Ghana is also good. What is from Africa is also good. Thank you for that proposal.
Thank you very much. Okay.
Yes, good afternoon. Good afternoon, everyone. Good afternoon, everyone. Okay, greetings. I would just like to say I congratulate the Coalition for Public Health and Justice for bringing this press conference. It is very important that the media in particular pay keen attention to what is happening in the world and in Ghana in particular. We often find a situation where the media is not proactive in social and political issues to the extent at which it is necessary. I am pleased to see that there are so many media outfits that are here today. So congratulate yourselves. Secondly, what I would like to find out is that if the government is searching around the world for solutions and is going to these biotech companies and the multinational corporations and these big countries for solutions and support, yet still we have a strong relationship with Cuba, a very strong relationship with Cuba. And Cuba has offered Ghana technological transfer of their vaccine, which they have produced 3 vaccines. And I'm sure the efficacy of Cuba's vaccines is way above Moderna, Pfizer, and all of those, right? So I'm asking the question, I'm asking the government the question, why have they turned their backs on Cuba? And Cuba is one of the #1 when it comes to health system in the world. Finally, I would like to say that I would like to see that the trade unions in Ghana, NUGS, the Christian Council, the Muslim Mission, all the medical institutions, traditional council, and civil society in general stand behind this advocacy. Give thanks.
Thank you very much. I think there's a last person who wants to. Yeah, Reverend.
Good afternoon. I think my question goes to the media. I think Sure. First, the last time that we had our last press conference, a lot of media houses came to cover the program, but we didn't see any show. So we were wondering why. What happened? They didn't show it on television.
Okay.
Sure.
So what he wants to say is that the press...
hold on. And secondly, we know what is happening in Ghana. A lot of people are complaining about the side effect that they got after they got the jab. But they are not talking about it, and we are wondering why the media house know all these things, but they are not talking about it on air. So that's my question. Thank you very much.
Okay, thank you. Thank you. So now we call upon the victims, if any, and no, please, we don't have data. Please, the victims who are here, direct what we are doing here. I beg you, the media, I beg you. You are not supposed to direct us as to what we want to do here. Please.
Hello, please ignore that. Please, the victims have a concern. I'm just trying to give a bit of a background. As you can imagine, this is a very sensitive issue. Hello? All right. We have some people who have traveled to come and share, but they are very concerned because it's a very emotional issue for them. So please, let's accord them as much sensitivity as we can. Is that okay? Can you stand? She says she'll try. Okay. Okay. She says she'll try. Please.
But I friend me doctors. Me made dear no. Na menyam. But na minim minyam hui. The first one nearby and I don't know me can call Wobi. Inti me wo wie and be 2 weeks. And I said me who me basa. Ti me call hospital no na. Doctor ka say menyam. Na omo ma me koye lab na me twa scan. Na omo ma me nru. Na omo say me enkonom. Ti me koye no asa still na me hu nyem yie ba me nim say ma wo be 3 ntie bia nyisen na ama me hu na ya me sa. Ti me san ko hospital ho na doctor ka che me say o change enre na mame. Inti me nko 2 weeks men samra. 2 weeks no anso na ise mo fie na ise me yam no eye me style bi na ise makuma no e contentem ti ne mfifra start ete me enti me tena se na masori na manum suo ase mo yam basa na me hu de menya me ho by manka minim seye nyinsen na enti ade chia na mko hospital na doctor no e ma medro bi se 2 weeks men samra. Ti 2 weeks no me kwa no bisa me se nyinsen no e free ho. And I'm say there be me by one kan che me say nyinsen no problem ho no say ene kwatwa scan ti me kwatwa scan no me san by no bisa me say me wo mani bi ho na me say me obi ho. And o say me obi ho de a ene we no de asai enti ma yenye me de ansi na yenyi to ye na me ka say there be me ba last year no one kan che me say problem wo ho o ma me kutwa bibia na ye den afide o kan say na o say onyama esesa akura no dan suo bim na odane dan ho ba me de no nsuo ni nyina wi afiri ho enti we bi na kwatale ma wode no ho enti se ye nyi a menya problem enti me nkofa sikamra enti wakan za no na me fe mi kun ka se ne me ko different hospital bia na oboa ade no betima yi ti me ko ba bi foforo no na omo so ko twa scan no say still ade no emsuo bia ni ho enti etale ma wode no ti Jesus still DNC na na ye enti DNC no ye no Monday enti doctor no catch me say onwo me pane obeye because just a yinam see you enti ye start ye o twi ade na sanko enti wo ye bia fe the doctor no say why dey ya ba se me dey no edin o twi ade na enye yie because bibia free ho amana ye tintan ti oyi a emma enti wo try bia na wo hwa wo yi bi na bisa kai na ma medro bi se me nkonom na de aka ni nyina beba ti me ko ye no Friday still na se me ye fro no eye de bi ntim sa ka na doctor say ise san ye me biem enti that time no bisa me se ma wo pane ni bi na mso medical ko wo bi na na minim se menyam wa anka hwe no se ne ise san ye me another DNC ena mo ye me foforo ena omo yi ade ni nyina efim sana median.
Okay, it's a very sad one. Thank you very much.
Enti ba konso esan ka ho no na ye mi kunu ono ka che me se ne ho ya no basa ena me de ne ko 37 ti e ko 37 no na omo ye no labs bebre omo hu ade kura ha no inti yakoye we ni akoye we 2 days ena no free ti o free mu no na wa wo bi enso omo anje de hu ade kura pa inti me kwaje yi no death certificate no mo say covid na wanya inti na wu inti mi kuni wu ye no na nipa ono so be she mi kura nan wo adwuma nim no na onwo bi ti ene na ye ni ye bibia na ye de ne she mi kura nan wo adwuma mu ho inti Monday no ko wo pane ni bi ti Monday na me ne kasa no say wo pane ni wi ye ne ho ya no basa inti wako hospital but almost onye pala inti wa be fi ti ade chi Tuesday ena okọ adwumam ti adwumam ho no na oye ko na ase ne phone no etofom ti no munim se bia odi agro nti omgohwe no na isa ase okọ off no mde ko hospital to mde ko hospital no na omde ko emergency ti ade ko emergency won na jese won so afrim enti ebisa abusuafo no bae no mse ompese omuhu ade kura eku omu nipa no because na onyale enti doctor no say omde no bae no na ni ntini use eyi na moja ne fem no asisi enti na ni ho eyi no moja ne nyina abobo apo intimi enye anya adwuma saa time no enu nti na ofiri mu anu se one.
Okay, that's it. Okay, thank you very much, my colleagues from the media, for joining us to have this successful engagement, and to our key speakers too, we say thank you very much for showing up.